Welcome everyone to our second webinar for HPV Prevention Week 2022. Today's presentation is from Dr. Christine Palmay on Teen TikTok, Engaging Your Adolescents in Healthcare Conversations. So Dr. Palmay graduated from Western University, Phillips School of Medicine in 2006 and completed her residency at the University of Toronto in 2008. She currently manages a busy family medical practice in Midtown Toronto. She's been listed in Now Magazine's Best Of list and was honored by the Federation of Medical Women of Canada with their 2016 National Reproductive Health Award. Dr. Palmay's passion lies in providing comprehensive medical care with a focus on preventative medicine and women's health. She speaks and writes regularly on topics such as immunization and contraception, and has a passion for public education. Dr. Palmay, thank you for joining us, and at this during HPV Prevention Week, where while the focus is on HPV, concerted focus is on this week. Obviously, the Federation's activities are year-round, and thank you for joining us, and we look forward to your presentations today.
Thank you for the kind introduction, and just what a pleasure and honor to be here. I'm here to talk about adolescent healthcare and how we engage this very special patient population going forward in a new hybrid model of medicine. So HPV is certainly not just a concern for adolescents. It's a disease for both males, females, and no age restrictions. However, adolescents do mark a special time period where as primary care physicians, whether you're a nurse practitioner, a pharmacist, or a family doctor, you can harness somewhat of a sense of engagement, an inquisitive mind, and perhaps set the stage for future excellent healthcare choices as these young adults become older adults. These are my disclosures. I have the honor and pleasure of speaking with several pharma companies across all areas of primary care. So in terms of adolescent healthcare, I was certainly a dirty, rotten teenager at some points in my life, but mostly I was a young woman who was truly engaged in political issues, engaged in media concerns. And I think that adolescents are often underestimated. And although you can't, picture everybody with one brush stroke, we also have to understand that individual healthcare really is individualized, and assessing an adolescent based on their competence is a case-by-case situation. I have some adolescents that, quite frankly, are more articulate and able to make decisions than their parents. So in the spirit of adolescent care, we're not going to use the word old. We're going to use the word that we are well vintaged. The objectives are to provide an overview of common health issues relating to adolescent health, to summarize the systemic approach when dealing with adolescents, and to provide digital resources, which will be available on the Federation's website and hopefully provide some options to you when communicating with our youth. So some key points: do not underestimate the role of an adolescent in their healthcare decisions. Some of our teens may have missed school-based immunization programs due to the COVID closures of public health programs within schools. So a bit of call to action for primary care. We need to catch up, and we need to actively recall these patients. We're going to talk about how to empower youth and become involved in their healthcare decisions. We're going to talk about how to make that very, very time-limited opportunity, take advantage of that time-limited opportunity before they go to university, college, before they travel, so that you have an established relationship that they can go back to if they're having any concerns in the years going forward. And embracing virtual consults. Out of any demographic, this particular demographic knows TikTok, knows Instagram. They can probably teach us about tech. And what a wonderful way to maximize the benefits of hybrid care. So once again, I was quite frustrated as an adolescent when the assumption was that I was too young to make decisions, to do certain things. So making no assumptions is a huge part of ensuring that you're developing a mutually respectful relationship. So a few hot teen topics, and this is not just Dr. Palmay's perspective. I actually polled a few of my adolescent patients. We're going to talk briefly about mental health, sexual health, wellness, skincare, immunizations very broadly in general with a focus on HPV, obviously, and we'll talk a bit about what happened during COVID. So mental health. Pre-plague, mental health has always been a burden, particularly for our youth. But during COVID, we saw the rates of youth mental health reach outs just skyrocket, suicide rates increased, eating disorders increased. And the reality is that increase in need was matched with a decrease in resources. So the onus becomes on primary care to provide options to our patients. Social pressures related to social media, body image, school, success, self-worth are often and continue to be an issue, and substance abuse, cannabis, alcohol, smoking, and vaping. So teenager post, this is from Tumblr. My definition of a clean room is a clear path from my door to my bed. Not every teen, but some teens. So just in terms of providing resources, and these again are available on the website, I have several templated emails and consult notes that can be cut and paste into your EMR. They can be printed and included in your chart that provide you a framework as to how you have discussions with patients so we're not missing. I'm not going to spend time going over them. You can certainly download the resources. In terms of what happened during COVID, a study was done specifically on young adults in Canada. So theoretically, we knew when lockdowns started, we were concerned about our youth. We were concerned about school closures, any healthy coping mechanism, after school activities, gyms, sports, those were no longer accessible, and unhealthy options, social media addiction, alcohol use, vaping, smoking, drug use skyrocketed. I encourage you to look up this commission report. It is included in the resources. And I draw your attention to the younger cohort here, the first two bars. So our youth aged 15 to 35. There's no doubt that COVID lockdowns affected all ages, all demographics. But if you're looking at the younger patients, such a high percentage self-proclaimed a poor state of mental health. And this was self-disclosure. So I imagine due to stigmatization, severely underreported. So what were the main factors that led to this self-perceived sense of a decline in mental health? Obviously, isolation, loneliness, lack of access to schools, to friends, to after-school activities. And when they flipped the discussion and said, look, you're obviously suffering, how would you like us to communicate with you? By far, youth, and these were the younger patients under 35, emphasized that they really wanted online resources. They included friends and family and re-entry into school, but they want a DIY digital option. Once again, highlighting the importance of including this patient in a hybrid model of care and perhaps targeting them for virtual care. This presentation is very much resource-based. So in terms of crisis centers, these are the top 3 right now available across Canada. They have call-in centers. And just as a note, Kids Health Phone has increased their workforce by a factor of 3, obviously reflecting an increased need. In terms of online resources, so, our young Canadians ask for online resources. Finances are limited when you are young. And these are some free great online resources supported by the psychiatric community. Mood Gym is run out of Australia, has self-guided meditation, anxiety, breathing exercise demonstrations. Bounce Back, and I strongly encourage you to look into this program. It's a Canada-wide program. Provincially, they have provincial chapters, and patients can self-refer, which is a huge factor. Patients can fill out a survey, self-refer. You can also refer as a healthcare provider, and they get access to funded, albeit limited, but still funded CBT. This is a result of the Bell Let's Talk campaign. And Mindfulness Online is a partially subsidized program with excellent online resources for both patients and their parents. In terms of referral sources, so if you're looking for needles in the haystack, I always cite the example of a young patient who was a violinist who was struggling with mental health because her practice sessions were closed, her symphony practices were closed. I gave her a referral source. She called in. Intake personnel spoke to her, and they actually found her a needle in the haystack resource for mental health for artists. I would never have been able to find that resource. So the actual referral sources are not paid. Patients are free of charge. Ultimately, when they get linked up to a program, they will have to pay. So they have to have some private coverage. Substance abuse resources. I think it's really important for us to have a frank, plain, and honest discussion with patients. Patients are suffering, and obviously, in some cases, they're not going to disclose this unless you actually ask. So we have some good resources here in Canada. These are Canadian based. They also have a portal for patients' families. When substance abuse exists, it's a family crisis. Unfortunately, Canada wins one of the awards for our international vaping rates. I'm always shocked to still see the cartridges and the vaping supplies available readily at corner stores. I don't think that IDs are often checked. And in fact, Walmart, a huge corporation in the States, acknowledged that this was a concern and no longer sell these devices in the United States. So we have an ongoing problem here in Canada. There is a false perception that vaping is a healthy substitute for cigarette smoking. It's absolutely not. Many patients have ended up in acute lung failure in the hospital, so we need to actively educate, and in some cases, educate our youth parents who may have the same misconception. Again, Canada has one of the highest rates of cannabis use thanks to legislature. Unfortunately, the legislature did not use the advice of our police force nor our medical community, and youth have ready access to cannabis. And it's just skyrocketed during COVID. So once again, even though it's considered to be legal in most cases, we have to have a discussion with patients because productivity during this time significantly increases. A person who's addicted to cannabis when they're young may not achieve academic success, social interactions, and really set the stage for declining health in future years, a huge concern. Resources, again, Drug-Free Kids has resources for multiple ages, so for 12 to 21-year-olds, as well as excellent resources for families. This is a resource tool that I include in my emails, a summary of online resources that are available, as well as a gratitude journal. I started doing this during the onset of COVID, and it's become one of the most successful endeavors in my office. Patients come in, some people who can't actually put words together or articulate themselves during a virtual or in-person appointment. They'll write down what they're feeling and provide me this, and I read it after hours and have a bit of a sense of what they're dealing with. Some apps, patients want digital resources, they want online resources. These are some top-rated apps by the patients I polled for this presentation, and some of these have free options available. In terms of bibliotherapy, everybody likes different types of resources. I have patients that still like books, and these are some books that I recommend. And workbooks. Both of these workbooks have been suggested by some of my psychiatric colleagues. And in fact, the first option, the Anxiety and Phobia workbook, I think it's all of $30 off Amazon, has been proven to be as effective as CBT. So in cases where patients like the DIY workbook option, these are two credible resources that you can offer. So Teenager Post, I wish everything I liked was less expensive or maybe even free. Quite frankly, this is not just a teenager issue. I tend to have similar thoughts. So just a quick overview of sexual health, our second topic. We'll talk about birth control and safe sex practices, including consent. A wonderful Canadian-based resource is sexandyou.ca. Put out by the SOGC. It talks about everything from gender identity to contraception to consent, a great resource for clinicians and for patients. I encourage you to readily offer this as an option. And the Acne Canada for Sexual Health and Rights, consent is a huge issue right now. And in fact, I have to educate myself regularly because guidance changes. Contraception resources, you don't know what you don't know until you know. And I find some patients, are still not aware that there are other options besides a birth control pill that may be more suitable for lifestyle or risk factors. So make sure you're educating and providing informed options for patients. Smartphone apps, with COVID vaccines and patients' travel and changes in lifestyle, I'm sure we're all getting panicked calls about changes in menstrual cycles. So I encourage patients to start learning about their cycles. It's amazing how far removed we are from understanding our bodies. And these are 3 apps that are available, 2 of which are free of charge. Missed pills and missed rings are still a concern, especially during lockdown when schedules changed and people weren't necessarily getting up at the same time or going to bed at the same time. So make sure a patient is educated. These are resources that I always attach to follow-up emails. And again, consent, a huge issue. You need to ask. You need to ask directly. Oftentimes, patients who have been violated obviously aren't going to be forthcoming, and it's a pervasive issue, unfortunately. Teenager post, that moment when you and your mother's almost home and you look around and haven't done anything she told you to do. That was me on some days. Quick overview about the third topic, lifestyle. We're going to address nutrition, activity, and wellness, sleep or lack thereof. We're going to provide some resources that you give to patients. And, talking about that patient that's just about to leave for university, have a gap year, how are they going to segue into being an adult and realizing that you have to go to the grocery store to buy milk? And just a quick note about red flags, body image concerns, fad diets, restrictive diets. Out of all mental health conditions, eating disorders have skyrocketed. I think it's really important to understand food. And it's important to encourage our patients, especially those who are leaving home, to learn how to cook. These are some evidence-based websites that are wonderful. They have online cooking classes and set the stage for good nutrition and good nutrition choices going forward. We don't want our youth to be eating craft dinner for 4 years as their way at university. Participation or Participaction is a wonderful activity resource out of Canada. The government of Canada has some suggestions and guidelines. Yoga for Youth is an online free channel. Patients can do yoga at home. Really quite important, not just during lockdown, but also when they're away at school. And I also encourage you to tell your young patients to reach out to their local gyms. Good Life, oftentimes during the summer, have free options for our youth patients as long as they're in school. Body image continues to be a concern. And as I mentioned, eating disorder rates skyrocketed during COVID, partially because of the impact of social media. This is a wonderful book written by a set of twins who are both PhDs, so it's Dr. Squared. And I think it really speaks well. It destigmatizes the concept that your body is an aesthetic issue, and more so that your body is a vessel, and it allows you to do wonderful things in life. And I think we have to reframe the discussion. Sleep. There's no doubt that youth and particularly our adolescents have different circadian rhythms, but unfortunately schools sometimes still start at 8 a.m. So we have to talk about sleep, and we have to ask directly how much they're sleeping, what are they doing before sleep. We have to talk about lifestyle changes. Are there comorbid mental health concerns that are interfering with sleep? And try to have some semblance of a routine. These are excellent sleep resources. They're generalized, but they also have some portals for our young patients. And these are 2 resources that I include in my emails for a patient who's struggling. There's a particular resource here for sleep and grades. We know that sleep deprivation adversely affects academic success. Teenager post again, I automatically start panicking when I can't feel my phone in my pocket. And I think that extends to adults as well. But our teens really like their phones. They forget their health card, they forget their wallet, but they certainly don't forget their smartphone. Acne, I encourage you to, especially with your male patients, ask them how they feel about their skin, because sometimes, patients aren't forthcoming, and particularly now when people are masked, we aren't necessarily seeing the whole picture. I feel that patients, have a sense of overwashing. So going over proper healthcare skin regimens, you have to wash your face, but you have to hydrate and you have to use SPF. Avoiding picking, a huge emphasis on SPF protection. We want to start early, and consistent use of those lotions and potions. I generally ask my young patients, in fact, all my patients, to bring in whatever topical ointment I prescribed. And when it's still full 3 months later, you know that there's a compliance issue. I get no subsidy from any of these companies, but they are all dermatologically approved by major Canadian organizations. Cetaphil and CeraVe, relatively inexpensive over-the-counter options, and an excellent SPF protector, excellent sunscreen. Patients want guidance as to brands, and these are available at Shoppers. They're not fancy. Another post, teachers, when 90% of us failed, it's not that we didn't try, it's just that you are a terrible teacher, not for everybody, but for some, especially, with virtual care emerging as an option. I find that a lot of my patients have to relearn how to participate in vivo. Immunizations. So in general, I feel one of the silver linings of the COVID pandemic was a newfound appreciation of preventative healthcare. We need to take this time-limited opportunity and educate our patients that while COVID and COVID vaccination is still forefront and important, there are other preventative care measures. There are other vaccines that are equally as important. And unfortunately, due to the closure of school-based programs, we have a crisis in our hands. Our youth missed their equitable, publicly funded in-school programs. And unfortunately, public health units are doing things differently across not only the country, but within a city. So as primary care providers, we have to be proactive and ask patients and ensure they're being caught up. So at about 14 to 16 years old, I have something called Teen Talk with Dr. Palmay, and the immunizations that I go over, are tetanus. Is there tetanus updated? I talk about meningococcal C and B. I talk about HPV and hepatitis A and B, particularly because many of these patients will be traveling. So just a reminder that the school-based public health programs were essentially closed during COVID. They have reopened in some locations, but unfortunately they run during school hours. So it's not as easily accessible as having those clinics within the school walls. So as primary care providers, actively recall your patients. Parents have to do a bit of digging to see what was administered and what wasn't. And certainly in my territory, I can order these vaccines and administer them in their office. In terms of record keeping, we still don't have a centralized portal. Hopefully, as a result of COVAX, this will be extended to include other vaccines, but at present, the information is a bit hodgepodge, and I no longer want to see another illegible health card or yellow card, with multiple versions that you're trying to decipher what did they receive their typhoid in 1962 or 1992. Have your patients download a free app. It's called Can Immunize. The website is here. It's coast to coast, multi-user, so parents can keep track of their vaccines, of their kids' vaccines, and also it engages patients in their healthcare, provides a bit of education and a reminder for upcoming doses. So just a reminder, we are over inundated right now. As primary care physicians, we are trying to catch up to get ahead, and our appointments, much like this presentation, are jam-filled with issues. Can we afford to spend time talking about immunizations when we're talking about PAPs, we're talking about sexual health, mental health? And the answer is absolutely yes, because our input is by far the most significant reason a patient chooses to get a vaccine. They've done several versions of this study, regardless of patient demographic, regardless of vaccines. When they ask patients why you didn't get a vaccine, the most common answer is consistently, nobody talked to me about it. So encouraging our colleagues, ourselves, to continue to rally and have those vaccine talks at every visit. It is HPV week, so let's spend a bit of time talking about HPV. Why? Why are we talking about HPV when we're talking about mental health, when we have COVID vaccines? And the reality is that it's a vaccine that prevents cancer. That is a huge point and really resonates with patients. It's an option for sexual empowerment. It provides us the ability to be proactive instead of reactive. During the past 2 years, where we've only had the option to be reactive, we're trying to vaccinate ourselves out of a pandemic. Let's flip the switch and be proactive instead. This is a vaccine available to men and women of all sexual orientations, of all ages. And just a reminder that patients miss school-based programs, so that there is a bit of an onus to catch up. The burden of HPV is not just restricted to cervical cancer. We've been talking about this ad nauseum all week. Just a reminder, we're also considering anal cancers, genital cancers, precancerous lesions, head and neck cancers, and we are including males and females. This is not a disease of young women. You'll note that cervical cancer continues to be an issue. The rates are declining, but anal cancer and oropharyngeal cancers represent a huge portion of HPV-related diseases and are often missed because we do not have any screening for these disease states. Patients come in for PAPs. We have an option to pre-screen. We do not have an option to pre-screen for anal cancer or oropharyngeal cancer. So the take-home point is the best option is primary prevention, upstream protection, and that's vaccination. This is another way of looking at it. If you're a chart type of person, other cancers are equally as important. And just a reminder, and another way to get your young patients in, as soon as a patient crosses that 15-year-old threshold, a 2-dose HPV schedule turns to a 3-dose HPV schedule. This is for immunocompromised patients. For immunocompromised patients, it's 3 doses. But our patients under 15 only need 2 needles for HPV. And as soon as they become 15, it becomes 3. And I guarantee once you tell them that will probably get them into your office pretty quickly. Patients want a guide to the internet. The internet's here to stay, by the way. So why not provide people a bit of a roadmap? And these are wonderful resources that are geared towards youth about not only COVID immunizations, but immunizations in general, mental health, etc. I encourage you to share them with your patients and even check in with them. There's some wonderful resources that are available. This one's published under Unity Health about Vax Facts, specifically for youth. And I think it's really important to understand that the discussion is not just with parents. I've had some parents who have chosen not to be vaccinated, whereas their children have. So once again, do not underestimate the ability of a young person who is engaged, who's knowledgeable, who's competent to have a role in their healthcare decisions. Some youth hubs about COVID. Mental health is a huge concern and often is a barrier to healthcare, because patients tend to recoil. So I'm not suggesting we aggressively reach out. I suggest that we gently mention that we're here and provide some resources that are not only evidence-based, but credible and speak in their language. Some resources that are available to you on the website. These are self-made in Word documents. Feel free to cut and splice them. But when a patient's in my office, particularly with influenza coming up, instead of having them read their smartphone or play, Wordle, I have them read this. Thank you for coming in and making vaccines a priority. We salute you for getting your influenza shot. This is post-care instruction. But here are some other vaccines that you are eligible for. And similarly, COVID's still a hot topic, provide resources. And if you cannot answer questions or are overburdened, you can call in the Calvary. They have a wonderful Callin Centre run through the Scarborough Health Network. There's a similar center through Hospital for Sick Children where patients can call and speak to a healthcare provider about their concerns. Teenager post, my eyes are saying sleep, but my mind is saying internet, a huge problem. Social media addiction, not only for sleep, but for mental health. So let's talk about virtual care and that teen TikTok, so the teen talk time that I set up. When I told my staff about this, they rolled their eyes. And it's one of the most highly requested patient engagements, from my particular practice. So I talk about immunizations. I talk about all of the issues that I just discussed. I include resources. For a while it was digital, but now they're in packages for when patients come in. And, certainly in our office, and I think in probably most offices, we have facial product samples, condoms, and other sort of handouts that you can include. This is the header sheet that I include, a back to college option, as well as a personalized email that you can either email or you can print off and include, and once again, available to you in the package. So in the spirit of what did you learn today in school? Classically, you get a response saying nothing. I hope you learned something today. Engaging youth in their healthcare choices is important and valuable. Do not underestimate the knowledge and decision-making power of young adults. Foster a personal relationship for future healthcare issues and hopefully set the stage for excellent healthcare choices and an engagement in the person's healthcare care going forward. Make healthcare a personal priority, have those personalized discussions, and be resourceful because our youth want us to provide digital resources, friend the internet and digital tools. So just to complete the presentation, there will be a minor baby boom in 9 months. This has been ongoing, and then one day, and we can sort of extend this to 2034, 35, we shall witness the rise of the quarantines, a new term for our youth conceived during the pandemic. Thank you so much for your time.